I'm Amy Stroud. I'm 41 years old, and I live in Somerset, Kentucky. I am the Senior Vice President of Fort Broadcasting. We have 25 radio stations across 3 states, but we're Kentucky-based. A colonoscopy was never something that I intended to have or thought was even necessary, but in November of last year, I started feeling a little pain in my lower abdomen. I went to the ER here at Lake Cumberland Regional Hospital one morning, early morning, and the doctor saw me and knew something wasn't right, but didn't think cancer at all. And finally, the last doctor who saw me said, "You're not leaving the hospital without a colonoscopy." And I had wonderful doctors throughout the day, but I don't think anybody thought that a 41-year-old woman who was healthy in every other way could possibly have colon cancer. So I stayed here at the hospital overnight, had a colonoscopy the next morning, and Dr. Horn came out after the colonoscopies, and we found a little surprise. It was a mass in the colon, a pretty large one. But he said, the good news is it's a soft mass. It's probably cancerous, but since it's soft, we maybe have caught it early. So we scheduled the surgery and had the surgery a few days later. With the surgery was with the Da Vinci, with the robotic, and it went very well.
The robot has really made advancements in all types of surgery, especially in intra-abdominal surgery, which includes colon surgery. It has made advancements in not only benign disease such as diverticulitis and inflammatory bowel disease, but we've really had a great increase in the level of care that we can give our patients in minimally invasive surgery for colon cancer. So these have become procedures that we can do through 4 small incisions instead of 1 very large incision, which gets the patients back to their life faster.
And all of the doctors were just great and made me feel a little less nervous. But it was just the whole atmosphere here at the hospital. You always felt like you were almost their only patient, and of course I wasn't. Go to your doctor. Go to the doctor. I just can't say that enough, how important that is to get yourself checked, get your blood work, to try to prevent, if you have cancer, to try to prevent it and catch it early.
We have decreased scarring after surgery, decreased pain. The need for opiates goes way down with this type of surgery. We also have a patient that can get back to life much faster. And then we also have the advantages on the surgeon. The surgeon has much better vision. It is easier on the surgeon, so the fatigue is much less. We actually have 2 robots now, so we're working very hard to always be on the cutting edge of surgery for our patient population here.
You know, you've got a great team here of doctors and nurses who are the best at what they do. They took care of me and they saved my life.